Okay, hello again, everyone. My name is Bethany Sloan. It's been a while since I got on here and made one of these videos. I said that I was going to do it more regularly. That was when I first got my PICC line put in. I think I'd just gotten back from that trip and my first infusion when I said I was going to do that. Needless to say, once my treatments started, became regular, pretty much got slapped in the face with the reality of what I was facing. I mentioned herxing on the last video, and it's kind of where you're experiencing some symptoms you may already have been experiencing, or it might be new to you when you have Lyme. But when you have a treatment, when it starts to work and it starts to attack the bacteria, you have like herxing. The first few times it happened, my husband thought that I might be having a seizure. I kind of thought I was too, but you lose a little bit of control in some cases. I don't know if everybody does it. I know that I do. Not every infusion, but I definitely experience my fair share. I get some twitches, had some today, so if I twitch a little bit, I think they're mostly gone now. But so people have been asking me, when are you going to update that or let us know how you're doing? So it's been rough. Not just on me, on my son, on my family, my husband, my in-laws have been coming down. Patsy and Billy, bless you guys, they've been coming down. My father and his wife, they've been coming over every day pretty much to set up my infusion and my PICC line, cleaning for me, just helping take care of basic things or run me to the grocery store. My sister and Dustin, her husband, they've been helping as much as they can, taking me grocery shopping, and my mother. Everybody really has been so understanding and just so great about it. My granny has even come to do my infusions. Friends have come to learn, just to be there for me. It's not really in a place I can reach myself, but yeah, it's been really rough. The pain has gotten worse. When I went to the doctor, both the first and second time that I met with him, we talked about that, and it's just unbelievable, because you really, when some days I really look horrible, but even on better days, when I think I look almost like a normal person, the pain never goes away. When I was sitting in the doctor's office and he was talking about, that this bacteria is a spirochete, so it's spiral shaped, and talking about how, it goes through my system, and talking about my treatment plan, and it was just all kind of like a fog for me. Most days are right now. But I remember asking him, when will I see a bit of the light at the end? And when will the pain start to go away? And this man walked across the room And he hugged me, and he told me that I had to be strong because I was about to go through the belly of the well, walk through the valley of the shadows. And he was right. I mean, some days I wake up and I feel like I've been ripped apart, like my limbs have been taken and patched on. So it's tough right now. But like I said, I have a lot of loved ones, and this is supposed to be therapeutic for me too. So, but I thought I would show you guys, with my PICC line that I have here. I got it kind of moved around. I was having an allergic reaction to the patches, so I have to wear the hypoallergenic ones, which I don't think we pulled the cover off of that, but that's okay. But this is how I get the medication, the antibiotic medication infusions that I do. Instead of an IV bag, I was going to show you that they come like this. And these little, this is the bigger one that I do this one once a day. And then there's 3 others that are a little smaller than this that I take at least 4 times a week. Might increase that, but it pretty much, you clean it all, flush the line out, and connect this part on. You pop that off and connect it on. And then this has like I don't know, some kind of like pressure release where it like over time releases it so many milliliters a second, and they don't have to hang up high, they can sit low. We're actually trying to knit a little bag that I can put them in, so during that hour and a half time frame that I'm infusing, I can move around more if I am able to. So I want to show that to some of you because you had questions about the treatment. And so far, it's not going to be covered past 28 days. Just for the basic antibiotics, it's going to be just under $500 a week for these. And the supplies, sterile supplies that come with it, but I also have to start some compound, like rub-on kind of medication that I have to pay for myself too, but it's supposed to help my liver, it not be so hard on my liver, all these antibiotics and everything, and I also will be getting injections every week, another compound injection. I don't really understand all of it. I have my blood drawn every other week at the hospital. It's not far from here, thank goodness, that I don't have to drive out to Memphis for that every other week. But I do have to go to Memphis or Tunica, Mississippi every time to see my doctor. Sometimes we get a hotel room because of the time that they can see us. My dad drove me down and back one day when they had a last minute opening, just to talk about these again. So I don't know yet how it's going. He told me it would get worse, a lot worse, before it gets better. So if that's true, then I would say that we're on the right track. So I'm going to stop there for today. This video is a little longer, but thank you guys again for all your support. Thanks.